Hello, my name is John Hochter, and today I will be making a presentation on non-polio enterovirus D68, also known as EVD68, for my microbiology class. So here we have the classification of EVD68. This virus is most importantly of the family Picornaviridae and of the genus Enterovirus. Its species is Enterovirus D, and its serotype is Enterovirus D68. Here is an image of the viroid as it is outside of the cells. So this virus is a single-stranded positive sense RNA virus, and it is one of over 100 non-polio enteroviruses. It is unusual since it shares some characteristics with rhinoviruses and enteroviruses. These characteristics that it shares with rhinoviruses are that it has an optimal growth temperature of 33 degrees Celsius, and it is sensitive to acidic environments. The optimal growth temperature of 33 degrees indicates that it's able to grow best in the nose and the nasal cavities, similar to rhinoviruses. This similarity with rhinoviruses actually had this virus classified as rhinovirus 87 until its genome was sequenced in 2002, where it was discovered that EVD68 is genetically more similar to other enteroviruses than rhinoviruses. And just like other enteroviruses, the number of infections of EVD68 increases during the summer and the fall. This virus was discovered in 1962 in California among 4 pediatric patients, and the virus is icosahedral and non-enveloped. So the mechanisms behind the pathogenesis of EVD68 are not yet completely understood, but there are some promising leads being researched. So there are certain receptors on the virusoid, and these receptors interact with the alpha-2-6 linked sialic acid receptors on the surface of the cells of the host. And these alpha-2-6 linked sialic acid receptors, they're most commonly found on the epithelial cells of the upper respiratory tract. So it causes a lot of respiratory or infections within the respiratory system. Here you can see up above an image of alpha-2-6 linked sialic acid. This is attached to the outer cell membrane of the cell, and it's then attached to a sugar molecule or other form of molecule within the cell wall, and the receptors just attached to it. Signs and symptoms of the illness caught or an EVD68 infection are fever, nasal congestion, sneezing, coughing, and body and muscle aches. But it is believed that many people who become infected may remain asymptomatic or only suffer from slight symptoms. Due to the similarity of the symptoms to rhinoviruses, it is believed that this could be not diagnosed or misdiagnosed as merely rhinovirus. Severe signs and symptoms may include wheezing and difficulty breathing, and those who suffer from the mild signs may also, or those who suffer from the severe signs and symptoms may also suffer from the mild signs and symptoms. Acute flaccid myelitis is a neurological disease which affects the gray matter of the spinal cord. It was not until the past few years when outbreaks of EVD6 became more common that an association was established between EVD68 and acute flaccid myelitis. And this was only seen because cases of AFM coincided with infections of EVD68. There was no association prior to these outbreaks between EVD68 and AFM. So acute flaccid myelitis is it's really lesions that occur along the spinal cord and in the gray matter of the spinal cord, and these lesions interfere with the processing of information from the brain to the neurons of the body. And so this results in neurological damage and also signs and symptoms such as arm or leg weakness, pain in the neck, back, arms or legs, and difficulty swallowing or slurred speech, difficulty moving the eyes or drooping eyelids, or even facial droop or weakness. It's not fully understood how EVD causes AFM, but it may use a similar mechanism to polio. And it is rare. Acute flaccid myelitis is rare in EVD68 infections. So here on this slide, it's just showing you how the lesions occur. And if you look over above me, you can see that on day 0 and day 20 and day 68, there is the growth of a white spot in the gray matter. That is a lesion, and it is it's believed that the virus infects neuronal cells of the body and then lyses them open, and this is what causes the lesions. And over here is the symptoms of acute flaccid myelitis, and it just shows you what these symptoms look like. And if these symptoms do present, then the child should be taken straight away to the hospital. So the most prominent EVD68 outbreak occurred in 2014, and it was the largest outbreak of EVD68 ever documented. This was also the first outbreak where an association between EVD68 infections and AFM cases was established. For the 2014 outbreak, there were over 1,000 hospitalizations and 120 children were reported with AFM. The 2014 outbreak did result in 12 deaths. And the first cases were observed in the United States and Canada, but soon after, some cases were reported in Europe. The most severe signs and symptoms usually occur in children and teenagers, since they have usually not encountered EVD68 before, and this means that they do not have immunity. Those who have respiratory illnesses such as asthma are more likely to suffer from severe symptoms. And a subsequent outbreak occurred in 2016 and in 2018. However, these were not as um, severe as the 2014 outbreak. So currently there are no specific treatments for EVD68. Symptoms are usually reduced with the use of over-the-counter medications such as aspirin. Um, those who suffer from severe symptoms may need to be hospitalized to receive intensive supportive therapy. And in order to prevent catching EVD68 and from spreading it, it is recommended that each person wash his hands thoroughly with soap and water. Avoid touching his face with unwashed hands, and avoid close and direct contact with others if you feel sick or with someone who feels sick, and to cover your mouth with your upper shirt sleeve when you cough or sneeze. So currently, there may not be any treatments available for EVD68, but there are drugs and vaccines which are being researched. Some of the more promising drugs are V7404, and this is a protease inhibitor, and this helps to stop the replication of EVD68. DAS181. It is currently under development for the treatment of influenza and para-influenza infections, and it's believed that it may help since EVD68 shares signs and symptoms similar to influenza and para-influenza infections. And rupintrevir is another protease inhibitor. V7404 and rupintrevir, they successfully inhibited 4 strains of EVD68, which is extremely promising. However, these were done in vitro and no clinical trials have been done yet. And these are my sources. Thank you, and I look forward to hearing your questions.